Now I would like to give the floor for the next welcome speech to the head of the office in the WHO office in Europe, in Bonn, and European Center for Environment and Health, Francesca Racioppi.
Hello, good morning. I hope you can hear me well, see me well. It is a great honor to be today with you. This is now for me nearly a tradition after several years of joining you online at this conference. And in a few moments, you will also hear from my colleagues, the WHO representative, Dr. Abic. But a little bit of anticipation to that. I would like to say three things. First of all, my most sincere admiration to all of you for strength and resilience and for keeping looking forward for the great benefit of Ukraine and its people amid a very difficult fact at the time. The second thing that relates to this is that I believe we need to keep looking ahead. We need to keep forward, where the work that we are doing together as the environment and health community will take us to a better place from where we were before. The idea of the reconstruction and the idea of capitalizing on the opportunity that we are going to have together, do things differently and better, is something that should keep us very focused and full of hope. A few months ago, ministers of health and environment, and a strong representation from Ukraine as well, gathered in Budapest to address and to chart the way forward for the great challenges that we have related to the combination of climate change, pollution, and loss of biodiversity. That discussion is not happening in isolation from what is the daily reality in each and every one of the countries. And when thinking of Ukraine, when thinking of the huge damage that the country is suffering because of the effects of the war, with its vital infrastructure, and the need that we have to work together to prevent and redress, to move forward, this takes us to the core of that conference. As head of the Bonn office, I'm very happy and honored and humbled working with so many of you, with our colleagues from the WHO country office, from the WHO Health Emergency Department. We are working with you in the country and with the new colleagues and with new resources that have been made available to us through the generosity of donors to help and to support the way forward for Ukraine and for its people. So I will expand more on this in my presentation in a few minutes from now. But for the time being, let me thank you once again for inviting the WHO to be part of this community. We are honored of that. We are happy of being here with you. And we do hope to be able to continue to support you in every and in the best way we can. Thank you very much.
From the whole heart, we thank you, Francesca, for your help, for your advice, and for counsel in our institute, and for your annual participation in our conference. Thank you very much. And now, let me give the floor to very important information. Francesca, please, over to you.
Thank you very much. And I hope that you have received my slides, and many thanks for accommodating this small change in the program, because unfortunately I will have to switch to another meeting shortly after I'm done. So for this year, I'm very proud to be able to report to you some of the main outcomes from the Ministerial Conference on Environment and Health that, as I just said a few minutes ago, took place at the invitation of Hungary in Budapest in early July. The next slide, please. Okay, so to begin with, where are we coming from? When we gathered in Budapest, where were we sitting in terms of environmental and health challenges in the region? So we had started from a very big, a broad assessment of the so-called environmental burden of disease. This is a measure of what are the main issues that we are dealing with in our region. The next slide, please. And what we know is that, so first of all, which are the main challenges that we are facing? In this region, we have calculated, and these are the most recent estimates, we published them on the occasion of the Ministerial Conference, that we have nearly 100%, 97% of European people living in situations where the air quality does not meet the WHO guidelines. And this is a very disturbing knowledge because it translates into deaths. So we know, for example, and we have estimated that every year, approximately 569,000 premature deaths are attributable to outdoor air pollution alone, and 154,000 to household air pollution. So it means that bad air kills. Bad air is a killer, and it is a major cause of non-communicable diseases, including cancer. So this is why, as you are approximating also the European Union legislation, and that you will see that there is a huge debate in the European Union on reforming the air quality guidelines to advance them and to bring them more in line with the WHO standards. Let's turn to water and sanitation. This remains also what we call an unfinished point in the European agenda. We have more than 7,000 people, 7 out of 10 people who do not have access to adequate wash services. And this is one of the most advanced regions in the world, particularly in rural areas. And about 77 million of people lack safely managed drinking water. So we have a very large proportion, an unacceptably high proportion of our people in Europe who do not have access to water and sanitation. And it's hardly to believe that 350,000 people in 2020 and 2021 were still practicing open defecation. So these are numbers that you would not expect to see in Europe, and these are numbers that threaten our ability to reach the sustainable development. Preventable, as we all know. And as we have also learned through the COVID experience, when the importance of hand hygiene came to the fore, it became a very dramatic point in time when we realized that not everywhere, not in every healthcare facility, not in every school, not in every public place, we have the possibility of washing, doing something as basic as washing our hands with water and soap to prevent the transmission of deadly disease. We have uncovered new evidence regarding chemical safety. And chemical safety is also one of the key areas where we collaborate with your country. Dr. Irina Zanstenskaya is working very closely with your experts on this. Well, 170,000 deaths were attributable in 2019 in Europe to chemical safety. I wish now to turn to the key and the greatest public health preoccupation that we have and concern that we have globally and in Europe, which is climate change. Last summer, 62,000 people died because of the heat waves. And now that the winter is approaching, we are preoccupied by the large number of people who will be affected by storms, by deadly floods, but also by the lack of secure health, of energy security in the houses, energy poverty. It can create very important problems indoor to the people who have to live through a cold wind. So we have been looking at all these evidence, and we have seen by looking at indicators that unless we change a course of action, we will not be able to achieve the goals of the SDGs, the Sustainable Development Goals, by 2030. And we have also known that the experience of COVID, that we need to address the important failures in the systems that we have had in the past, in terms of planning, but also in terms of understanding how much climate change, pollution, loss of biodiversity are intimately related, and how they play together in a very complex way to undermine our progress and to create health issues. So this is why the ministers gathered in Budapest. They gathered there because they wanted to address these three issues, and they wanted to look at them in the context of the recovery from COVID, because this represents an unprecedented opportunity for us to do better. So we were very happy to see that more than 600 participants from 43 countries and very many ministers, deputy ministers. Your deputy ministers were there. Your Minister of Health was addressing the conference. So we had a very strong political support for our work, many plenary sessions, parallel sessions, and opportunities for people to come together in different configurations. So we were happy that the Budapest Declaration was adopted with a roadmap for action until 2030 to accelerate progress and to address the health challenges in the three pivotal areas interrelated of climate change, pollution, and biodiversity. What we want to do in Budapest is to accelerate action. We want action to be faster. We don't need more political or new commitments. We need to act faster, more decisively on what has already been agreed and established. We want to go to the bottom and to tackle the issues that are keeping us from making good progress. We need to strengthen, and we want to strengthen, the governance for environment and health. If we keep working within silos, we will not be able to move forward on that. We need to find different good ways of working across sectoral boundaries. We need to create, to do that, different governance systems, different ways of financing our work, but also new capacities in the workforce to cope and to understand and to move forward in this environment. And the other thing that we need to do is to have a good system to monitor and report, so that we know in which directions we are moving. What we did in Budapest is that member states adopted the Budapest roadmap until 2030 to support and to guide action on these different dimensions, so that they can prioritize these areas of work. They can deliver essential services in the safe environments for healthy and resilient communities, and strengthen the governance the resources and the capacities. Something that is very new and very important from the conference has been the development of the so-called environment and health partnerships. 4 of them were launched on the occasion of the conference, one dealing with the human biomonitoring, another one on health sector climate action, another on healthy active mobility, and 4th, not last, the engagement of youth in the European region. This is a new way of working together. It is a way of bringing countries together. We do hope to see Ukraine interest in joining any of these partnerships or leading on a new one. As a secretariat, we would be delighted to support you, and I see that my colleague, Ms. Nino Sharagidze, who is the leader of this process, is coordinating this. She will be just too happy of being in touch with you and follow up on these items. Last but not least, the Budapest Conference has been an incredible opportunity to engage and to bring together youth. The future belongs to them. We are the past. Whatever we have done that was wrong needs, unfortunately, now to be corrected still by us if we manage, but it will, to a large extent, be in the hands of the future generation. This is why in Budapest we made a very important point in engaging and promoting leadership by the young people. It is to them that the future belongs. And it is with these words that I would like to close my intervention today, to thank you once again for all the exceptional work that you are doing. You are a beacon of hope and resilience for all of us and for the world. And I wish you well, strength, resilience, and peace. Have a nice day, and I will be happy to be with you very soon, hopefully in person.
Дякуємо, шановна пані
Thank you very much,
Франческо.
dear Francesca,
І актуальну на сьогодні для України
for
найактуальнішу
very
тему,
important and
котру ви
relevant
сьогодні
for
нам
Ukraine subject,
розказали про проблеми,
which
які
you
є
have
і в
highlighted.
Європі,
Thank you for telling us about problems which
вони такі
exist
ж і в Україні.
both in
І
Europe
хочу
and in Ukraine.
вибачитись перед вами
I would like to
і
apologize
іншими учасниками конференції за технічні
to you
неполадки,
and other
котрі
participants for technical
виникають
issues
під час
which
проходження нашої
arise
конференції.
during the
Ну, це, ви
conference.
розумієте, пов'язано
Well,
з
as you know,
багатьма
this is
причинами
related
і
to
тим, що у
many
нас така
reasons,
ситуація зараз в Україні.
including our
Тому ще раз
situation in Ukraine.
вибачте,
So
щиро
my
дякуємо
apologies
вас
once
і
again.
сподіваємося,
Thank you
що ми
very
з вами
much,
будемо ще
and
довго
we hope
зустрічатись
that
і
we
слухати вас,
will
і
keep
навіть бачити
working
вас
with you,
в мирний час у
listen
нас
to
в
you, and
інституті.
see you
Дякую дуже.
during the peaceful time in our institute. Thank you very much.